Hi there, I'm Dre, the host and founder of the Dragon Network, an online member-based community where health IT professionals can share their ideas and experiences while they collaborate with one another on all things related to healthcare technology. So on this YouTube channel, we actually take some of the topics that we're discussing inside the network and we provide a little bit of information for our viewers because we think it will help the overall health IT goals. So for today, I want to chat about social determinants of health and what some of the workflow challenges are with incorporating SDOH workflows into a healthcare environment, in particular a hospital-based environment. So before we jump into the workflow challenges, let's take a quick look at the definition of social determinants of health. So according to the World Health Organization, the social determinants of health are the circumstances in which people are born, grow up, live, work, and age, and the systems that are put in place to deal with illness. These circumstances are in turn shaped by a wider set of forces, which include economics, social policies, and politics. So with respect to workflows, there are four main areas that we want to take a look at. So that's the assessment itself, the discovery, the referrals that are associated, as well as the follow-up. So let's take a look at the first one, assessment. So when we're looking at workflows associated with collecting information on social determinants of health in a healthcare organization, we need to consider several different things. So first and foremost, what types of questions are going to be asked? Are those questions going to be asked in an interview type format where the clinician is actually asking the patient, or are those questions going to be done in a self-evaluation type format where the patient is given either a piece of paper or a tablet or some form of interactive device where they can actually answer the questions on their own. So once you've determined what questions are going to be asked and you've considered the mechanisms that are going to be used to actually respond to the questions, the next thing you want to try to figure out for the assessment is who's actually going to trigger that workflow and at what spot in the patient care journey is that workflow going to be triggered. Will it be triggered on every presentation into the system, for example? So if they come for a clinic appointment or they visit the emergency department, if they're coming for a scheduled inpatient stay, is it going to be asked at that point? Is it only going to be asked at certain points? Are they only going to be triggered in certain events? So is there going to be an action on the clinician's part that would actually trigger social determinant questions to be asked? Or are they going to be asked of everybody? And last but not least, once they're asked, how are they going to be documented and recorded in the EHR? And is there a requirement to have them asked on a frequency of any sort? So like I said, they going to be asked every time the patient presents? Are they only going to be asked if they haven't been asked within the last 6 months? Are you going to focus on certain questions in certain areas? So there's a lot of challenges around this and a lot of different ways that a healthcare organization can actually approach the assessment component. So once you have the assessment ironed out, the next thing is the discovery itself. In the event that there is a risk factor or there is an area that requires addressing, the next piece of the puzzle is to figure out how the clinicians or those administrators that are working with the patient through the patient journey, how are they going to find what programs, services, and groups are available to assist with this particular risk area. There are numerous different social service agencies as well as nonprofits, volunteer organizations, community groups that are actually in place to try to address social determinants of health. It can be very difficult to sort of navigate your way through that labyrinth in a healthcare type setting. So you want to try to understand whether the services that are offered are going to align well with the patient. So are there considerations for faith-based or location-based? Is there cost involved with any of them? Are they a reputable organization, depending on what it is that you're trying to address? Are there any restrictions that they have in place? Are there hours of service? All those kinds of things become part of that discovery workflow where you have to try to figure out where the clinician or where the administrative staff member is going to go to access a list of the available services that they can utilize to refer to the patient. There are certainly some IT software applications that have come into the space over the last 10 years or so, a couple of those being Aunt Bertha or NowPow, that try to actually curate that list for your area and try to gather and keep that information up to date so you could connect with something like that, can also have policies and parameters around the ability to go on Google. You can curate your own lists, but the discovery of how to find what it is you're going to refer is something of a challenge that I definitely don't think you should overlook. The next one on the path is the referrals. So once you actually have identified an organization, a nonprofit, or a community group that is going to provide the service that you believe will help the patient in the risk area for their SDOH, how is it that you're going to refer the patient to the service? Is it going to be a verbal referral? Are you going to provide written information? Is there a requirement that an actual official order be provided? So does the organization that's providing the service need to know that the patient's coming? Is there a screening process that's in place that you'll need to go through? As with everything else, how is all this going to get recorded? So where is it all going to get written down? So if you manage to figure out how to get through the assessments, the discovery, and the referrals, the last piece of the puzzle is the follow-up. So when you're looking at a patient and you're trying to improve their overall health and well-being, how are you going to be informed as to whether or not the patient followed through with the referral or recommendation that you made, or whether there's still a gap and there's more intervention that's required? So is this something from a workflow perspective that is going to involve a phone call to the patient to actually follow up directly with them? Is there a follow-up that can occur with the service that they were referred to, or the providing organization that they were referred to? Is there an electronic connection that can happen there? So what exactly is that follow-up process? And most importantly, how does that get documented, and who's actually going to do that? So if we take a look at, for example, social determinant of health workflows in an emergency department, those tend to be sort of one-time focused events. They're not recurring visits. So if you do identify an area that requires some intervention and that there's a referral made to the patient, it's very likely that the follow-up is not going to be done by the actual emergency physician or the emergency RN that actually made the referral. So if the organization does want to do the follow-up, you'll have to figure out who does the follow-up, how that follow-up happens, and when it takes place. So some organizations have some fairly structured discharge follow-up workflows in place. You may want to incorporate this into some of those if it's something that you're going to follow up on right away. But if it's something that's going to be followed up over time, then there's a lot more things to think about in that area. So social determinants of health is definitely something that we're continuing to see evolve in the healthcare IT space. There are going to be more and more players coming in, but getting ahead of the workflows and starting to think through some of the questions now is going to give us a huge advantage when we actually try to implement things going forward. The other thing that you want to think about with workflows is when you're starting to define them, you want to try to tackle the ones that are easiest to tackle first. So put the simpler workflows in place first, following up with services that may be in the overall organization's partnership network or may have relationships already with your environment. Things like that are going to help go a long way, because as we start to enter more things in and we strive towards healthy quality in our environments, we're just going to see these things grow. So we want to make sure that we have somewhere to start. So I hope you found this video helpful. I realize that social determinant of health workflow is a very large topic and there's a ton of things we can talk about with regard to it. If you do want to have those conversations with some of your IT colleagues, I encourage you to check out the Dragon Network and see if it's a community that you'd like to join. I'll see you again soon.